Hi, this is Gautam here from Proton Fitness Academy. Today we are going to be discussing about a condition called diabetes. Diabetes is a condition which affects almost 6.2 crore Indians, and what's been shown is about 20 to 50% of heart-related issues start with diabetes. So that's why it's very important to discuss about it. So what is diabetes? Diabetes is a condition where the glucose level in the blood increases drastically. It happens because the hormone insulin, which is supposed to be the key to open up the lock within your cells to allow the glucose to go inside, isn't performing its job very well. In fact, there are two types of diabetes. There is type 1 diabetes where there is no production of insulin at all, which we are not going to discuss today. There is type 2 diabetes. This is a condition where the insulin is produced, but it's not doing its job effectively, or it's taking a lot of time to push the glucose into the cells. So this is type 2 diabetes. We are only going to be discussing the type 2 diabetes. So type 2 diabetes happens because of a lifestyle issue. So it's a lifestyle related disorder, which means to say it's happening either because of stress or because of bad nutrition or maybe a sedentary lifestyle or anything which is related to this. So here the insulin is not effectively functioning. Is there a test to check it up? Yes. So what happens is there is a glucose test which you can go and get it done, and they draw a blood sample from you. And in fact, there are two tests within this. There is a fasting sample and there is postprandial. In the fasting glucose test, they ask you to come fasted for 10 hours and they check your blood sample. And if this value is greater than 100, then it's termed as pre-diabetic, and if it is crossing 126, they get into the diabetes stage. Similarly, you have postprandial. So in postprandial situation, they give you a meal and after 2 hours they check the blood sample, and if this value is greater than 140, then it's termed as pre-diabetic, but if it crosses greater than 200, then it's termed as diabetes. So remember these two values. For fasting it is 100, for postprandial it is 140. If it is lesser than that, it's perfectly normal. If it is crossing that, then you're in the danger mark with respect to diabetes. So how do you control diabetes? What is to be done to control diabetes? For which we'll have to understand what is carbohydrate, because everything is linked to carbohydrate. So carbohydrate is made up of small molecules called glucose. Now within carbohydrates there are primarily two varieties. There is simple carbohydrates, there are complex carbohydrates. Simple carbohydrates are these molecules where you have very small, very lesser number of chains of glucose molecules, maybe about 1, 2, 3 like that. Whereas complex carbohydrates are those where you have long chains of these glucose molecules, maybe 10, maybe 15, maybe 20 like that. So it's a good idea to substitute the simple carbohydrates with complex carbohydrates. The reason why this is very effective is because simple carbohydrates get into your system, get into your cells very quickly. Within about 10 to 15 minutes they enter your cells. Whereas complex carbohydrates take much longer. They take about 2.5 hours to enter your cells. So which means that complex carbohydrates have a lot of time to enter your cells. So the insulin, which are not functioning very well, have a lot of time to actually push them into your cells. And you don't have a buildup of this glucose well within your bloodstream. So you can mitigate the effects of diabetes by shifting from simple carbohydrates to complex carbohydrates. Of course, having said that, you will also have to take care of your stress levels. You'll have to bring it down. Also, one should invest into exercise to keep diabetes at bay. I hope this video was helpful. Thank you.